Welcome to those listening for the first time, and welcome to those returning for another of my recorded webinars, specifically relating to healthcare funding from the CARES Act. My name is Domenic Segalla, and I lead the healthcare advisory practice at Withum. As a former hospital CFO for some 15 years, my goal is to provide you with relevant information and updates that I would have wanted when I sat in the CFO chair. Over the next 10 minutes or so, my objective is to educate and update you on the releasing of the remaining $70 billion from the CARES Act, and to discuss the new $75 billion of funding signed by the President on April 24th. If any of you have been following this closely, it's really like following the bouncing ball. So let's get started with some relevant updates. So as we talked, $70 billion remaining. So the first $30 billion, as everyone is aware of now, and I'll just touch on this briefly, was rolled out based on Medicare share of revenue. So HHS decided the quickest way to get it out, those who have filed cost report data specifically to their Medicare proportion of the total $448 billion. Those funds were sent out, $26 billion of it on April 10th, and the remaining $4 billion of it was sent on April 17th. The next portion of it is $20 billion. Now, this is a little bit different. This $20 billion is based on total revenue. Again, it's going to be based on the fact of a filed cost report. So they're taking the data from the CMS cost report, but this time they're using all sources of net patient revenue, included but not limited to Medicaid and uninsured. Just something important here. Similar to the initial $30 billion distribution, providers who receive funds to sign an attestation confirming receipt of funds and agree to terms and conditions of payment. And this is important. We looked into this a little bit more. The provider, you have 30 days from the date of receipt of funds to sign the attestation. If you do not sign it within 30 days, HHS will assume the provider has accepted the terms and conditions as set forth. So if you do nothing, HHS assumes that you're receiving it. After the $20 billion, we're going to talk about that in a little more detail. The next is the $10 billion to hospitals and areas hit hard by COVID-19. There's been some additional information that came out this past weekend. $10 billion to rural hospitals and clinics, many of which were already in a financial distress or a financial situation of hardship, and $400 million to Indian health service facilities. So you look at that and say 30 and 20 is 50, and 10 is 60 and 70. Where's the remaining funds? Another very important thing that I think impacts everyone listening is the federal government set up something called the COVID-19 Uninsured program. You can see here, there's a website, coviduninsuredclaim.hrsa.gov. And basically what it's doing is for all those uninsured patients that were provided treatment or care for COVID-19, beginning with February 4th, providers can go online and set up in the portal the required information, and they will be paid for those claims at a Medicare rate of reimbursement. Now, no dollar has been assigned to this, but as we just talked about, out of the $100 billion, there are some remaining dollars left. Whatever is left over, HHS Secretary Alex Azar has said the rest of it will be reserved for a second tranche of COVID-19 hotspot funding. So let's talk a little bit more about the $20 billion. This actually started to roll out on April 24th. And for those who had filed a cost report, those advance payments probably hit. Now, even if you did file a cost report, you still have to go into the portal and provide revenue information to verify the revenue accuracy. There's some confusion around this, but it's really those who did not file a cost report, such as physicians, who would have to go in and provide information as noted here at the website, the hhs.gov/provider relief. There's tax returns, there's revenue, there's lost revenue, etc. But again, I just want to stress, even those that did receive the payments or are going to receive, you still have to go into the portal and verify the information. The next piece is the $10 billion. So this is for hospitals allocated for hospitals and areas hit hardest by the COVID-19 outbreak, and it's being doled out by HHS. So we received information this weekend. The actual amount is closer to $12 billion and will be released to 395 hospitals that provided inpatient treatments to 100 or more COVID-19 patients through April 10th. So back on April 24th, providers had to supply information around COVID admissions, intensive care unit beds, etc. Now, this is something interesting. The state with the most hospitals receiving this funding is New York at 90, which makes sense. It's been the hotbed. New Jersey is next at 53, followed by Illinois at 33 hospitals and Michigan at 30. New Jersey is receiving what we've seen, 1.3 billion out of the 12 billion, and New York is 3.9 billion, with the remaining being spread out as noted. So again, this also goes back to, just like the other funds that were being doled out, you do need to follow through with the attestation. You have to go in and decide if you're going to keep the funds or not. And I think one of the important things to note on the attestation is there are requirements and guidelines. Clearly, you have to track the expenditures and the receipt of the grant money and how you're spending those. And the other importance is you have to agree not to seek collection of out-of-pocket payments from a presumptive or actual COVID-19 patient that are greater than what the patient would have otherwise been required to pay if the care had been provided in network. So basically what they're saying is you can't get the out-of-network rate. You have to, since signing this attestation, you have to agree to those in-network rates, even though they're out-of-network. And again, we're just talking, like I updated here, there's the website for the other $10 billion. Just a few other items to note on that is we had a client that if you did not receive the first 30 billion, meaning a portion of that, meaning you did not bill Medicare, you will not receive the second. So this impacts health clinics. This impacts some of our clients who are just strictly Medicaid. From what we understand, there will be other dollars rolled out to that. But at this point in time, to receive the second, you would have to receive the first. When you go into the portal, you'll actually see that. And again, another important note here, this is all based on your TIN, tax identification number. So if physicians in a group practice, the physicians will not be receiving the money. It's tied to that tax identification number. The group will receive the funds. Again, with hospitals, same type of thing. The next important piece here is, as everyone heard on April 24th, the president signed into law the Paycheck Protection Program and Healthcare Enhancement Act. So it was $448 billion in total. The important part for our discussion is there's an additional $75 billion for HHS to distribute through grants and other mechanisms to hospitals. Now, we've spent a lot of time researching this. It's still very gray in terms of it's written the same way the first $100 billion of the CARES Act was written, and we know those were all doled out in different formats under different methodologies. One thing that stays constant here is aimed at reimbursing providers for healthcare expenses and lost revenue attributable to COVID-19. One thing important here on this last page that I do want to talk about is it's giving the Secretary of HHS broad discretion to develop programs under these. So again, we're not clear exactly how it's going to be doled out, how it's going to be utilized, but clearly based on the past, it's going to go to the healthcare providers, it's going to go to the hotspots, and it's going to continue to work as a cash flow bridge to assure the continuation of all the healthcare providers. Just some important language here. The use for funds for expenses related to building or construction of temporary structures, leasing of properties, purchasing medical supplies and equipment, and increase workforce utilization and training, establishing emergency operations centers, retrofitting facilities. So really, if you think about this, it's any and all ways that hospitals are combating and preparing themselves and what they're doing to continue to provide services under this COVID-19. So again, I said I was going to keep it around 10 minutes. I just wanted to give some highlights around the next phases of dollars coming out. We talked about the $20 billion. The highlight of that is even if you received it, still go into the portal. You still have to provide some information. That's based on total patient revenue. If you had filed the 2018 cost report, you should be getting those funds. Then the $10 billion is for those hit hardest by the COVID-19. And I did skip over the last one, which is the $10 billion for rural hospitals and health centers. So they will also be receiving a direct deposit payment in the coming days. Those providers will be receiving a base payment and a percentage of their annual expenses based on 2018 cost reports. Current understanding, it's the same portal, the hhs.gov/provider relief will be used to supply required information if a cost report was not filed. And again, lastly, every one of the funding, and once those dollars are received, you have to go in and decide if you're going to keep it or not. If you're not going to keep the grant money, you have to tell HHS that. If you do nothing, if you do not sign the attestation, it is assumed that you will be keeping it and you will comply with all of those regulations. So again, that's a quick overview of what's been happening. It continues to change rapidly. And as things continue to change, we will again update you through a webinar and more articles that will be released from our healthcare sector. Thank you and have a great day.